can see that our waiting room has had a few attendees in it for a few minutes, so thanks everyone for your patience. We're really excited to get this conversation kicked off shortly. Of course, this webinar is an analysis of the U.S. Supreme Court anti-prostitution loyalty oath decision, and we're going to be exploring together what this most recent ruling means for our community of sexual rights activists and advocates around the world. And we really hope that this conversation is useful to everybody. We hope that it's interactive. And to that end, we wanted to kick it off with just checking in with everybody here while we wait for more people to join. If you could switch the slide, thank you so much. We want to hear from attendees just to get a sense of what you hope to learn from this webinar today and how we can shape this conversation over the next hour to be most effective and useful for you. We hope to, if you can drop your answers into what would be useful to you for learning in this webinar in the chat function of the GoToWebinar, that will be great. And you can select that to see that organizers and panelists can see your chat response. And that way we can just sort of have a conversation as much as possible over this format about what makes sense, what information we can provide, and how we can do follow-up afterwards to make sure that this is really a helpful webinar for everyone. So again, to folks just joining, if you'd like to enter sort of what you hope to learn from this session into the chat box of GoToWebinar, we'd really love to hear from you what would be helpful for your own learning and understanding, or what you would like to share with us so that we can also adjust our advocacy and work strategically together with you all. Also, if your chat function isn't working, please do feel free to let me know what your priorities are, and just you can email me. My email is on the screen, zbulls@srhrforall.org. So we'll give folks a few minutes to join and just a little bit of time to have a conversation in the chat function about how we can make this webinar very useful for everybody. And I think perhaps we'll leave the chat function up for 5 minutes. I don't believe that I've seen any responses. Just want to check in with my fellow presenters to see if they're okay. I do have one response now. So to folks just joining, we're encouraging attendees to let us know what information about the APLO ruling would be helpful to you over the course of this webinar conversation. And we ask that, if there's any specific points you want to cover, that you enter those into the chat box so that we can structure the rest of our conversation around what would be helpful for everyone. And if the chat function is weird, you can also feel free to email me at zbulls@srhrforall.org. Okay. I'm not seeing any chats, which is totally fine. Happy to just continue this conversation with the outline that Change and the African Sex Worker Alliance have put together. So maybe I'll give one more minute to enter what strategic information would be most useful to you over the course of this webinar, and you can enter into the chat. And then we'll move on to the introduction. Give it 30 more seconds. Okay, if we could switch slides. Great, thank you so much. So we are really excited here at the Center for Health and Gender Equity Change to be hosting this webinar conversation with our colleagues at the African Sex Workers Alliance. specifically Grace Kamau, joining us from Nairobi, Kenya, is on the phone and is participating in this webinar, and we're really looking forward to her insights about what is, how the landscape of sex worker rights activists has been impacted by the most recent APLO ruling from the US Supreme Court. So we're really looking forward to Grace sharing her perspective. We're grateful to her and to ASWA for shaping the content of this webinar and really helping improve and enhance our own understanding of what this ruling means for us all as colleagues and activists together. We'll also have Bandrew Snyder, the Director of Public Policy here at Change, give a situational analysis of what this ruling means, and she'll sort of contextualize the ruling in terms of, US Supreme Court implications and meanings moving forward. And I'm very happy to be facilitating this conversation today with my colleague, Liana. My name is Zoe Bowles. I'm the Advocacy and Partnerships Associate at Change. And Liana is our Public Policy Associate at Change. So now that we're all introduced, very excited to kick off this conversation. And with that, I will hand it over to Baron.
Good morning and good afternoon, everybody. I'm going to do a little bit of a crash course, knowing that people are coming into the webinar with different levels of knowledge about what is the Anti-Prostitution Loyalty Oath and why are we talking about it this morning. It's oftentimes called the Prostitution Pledge or Pepfar's Pledge, and it's part of the law that created Pepfar, the world's largest global HIV program and the US's global HIV treatment and prevention program. So it's attached to the law that created Pepfar, and it's been included in every reauthorization since 2003. It attaches to all Pepfar funding, and the reason I keep reinforcing that is US is full of funding restrictions, and some of them apply to all global health funding, some of them apply to all foreign assistance. Pepfar's pledge is specific to Pepfar, and it is a part of the law that says that no funds can be used to promote or advocate for legalization or practice of prostitution or sex trafficking. That's the direct quote. That's what can be done with Pepfar money. This is a pretty standard funding restriction, and it's never been challenged in court. It's something that's understood, even if we disagree with it. It's not something that that can be challenged. It's an understood restriction on how the US wants their funds used. The other part is the pledge part, and that's the speech part, which says in the Pepfar's authorizing language that no funds may be used to provide assistance to any group or organization that doesn't have a policy explicitly opposing prostitution and sex trafficking. That then becomes the speech, and it's about who can receive Pepfar money, and it says that if you're taking Pepfar funds, you have to pledge that you oppose prostitution and sex trafficking. That has been challenged since the very beginning, and that's what we're here to talk about today. Next slide. So we've had decades of court challenges on this, and I know that many of you on the webinar have huge lived experience with it and also with the court cases. So the court challenges have been about whether this is a speech restriction that's permissible as applied to US-based groups. It's really important to know how narrow the challenge has always been, and I'll keep reiterating that. The challenge to the Anti-Prostitution Loyalty Oath started in lower courts in the United States and worked its way up to 2013 when the Supreme Court, in an opinion written by Justice Roberts, who's still on the Supreme Court, and it held that it's an unconstitutional limit on free speech if it's applied to US-based organizations. So you cannot compel a US-based organization to adopt this whole point of view around opposing prostitution and sex trafficking. And it really is a First Amendment case. So for folks who don't spend their time on US constitutional law, it is very, very important to First Amendment landscape. It's a lot less important to global sex worker rights. because it was never going to be a challenge. The 2013 challenge didn't touch any organizations unless they were based in the United States, which for most of the global sex worker rights movement, getting or thinking about Pepfar money, that's not where they are based. So the 2013 case was held in favor of US-based organizations who did not want to be compelled to oppose prostitution and sex trafficking. What has happened over the last 7 years is that the US government has fought any specificity about who that applies to. So the question has always been, in the last 7 years, how far does the 2013 holding in the Supreme Court extend? Who is included in that decision about it being unconstitutional as applied? So the case that was decided just a few weeks ago was deciding whether the First Amendment barred the enforcement of the APLO on foreign affiliates of US-based organizations. So the framing on the screen right now is the framing put forth by the court. And the court did not agree this time that it should not extend to foreign affiliates. Can we go to the next slide? And I know there's a lot of legal talk early in the morning for Americans, and a lot of American talk early in the afternoon for our colleagues in Africa as well. So again, sort of the decision in 2013 was US-based organizations. The decision this past month was about how far does that go. And the US Supreme Court decided that only US-based organizations are exempt and that foreign affiliates have no First Amendment rights. That's an important holding for the affiliate structures for a lot of groups, and not just about the pledge, but it is limited to this question of foreign affiliates. The court made it sound like that was a very small thing, and that this legally distinct, super easy distinction is one that we all know and understand, and it won't have any bearing. I don't want to minimize who this holding does have bearing on, and that is global health organizations that have affiliate structures worldwide for a myriad of legal reasons and practical reasons. On a practical basis, you may not know that there's a difference between the different Save the Children's or different CARES or different Pathfinders. And so for organizations that this matters to, this is a very tough decision. And it creates a lot of tension between what maybe best practices, what the US-based organization can do and say and sort of engage, and how they can be viewed, and how their foreign affiliates cannot do the same things and not be as consistent. That lack of consistency is very hard, and I don't want to minimize that. So fundamentally, the decision in the end of June was that it is a narrow ruling that the anti-prostitution loyalty oath is unconstitutional as applied to US-based groups, but does not extend to their foreign affiliates. Next slide. So this is something that's come up a lot over the years. None of the court challenges in US courts have addressed sex worker rights. They haven't been about public health evidence, except to the extent that amicus briefs, which are non-binding supporting briefs that have been filed with the court, have raised some of these issues, and they haven't addressed human rights standards. That is a real failing of the US courts, but for this audience, I want to make sure to highlight that, because in other countries, this sort of anti-prostitution loyalty oath could be challenged on human rights grounds, on being bad for public health, on a number of other grounds that are not how court cases are decided in the Supreme Court in the United States based on our Constitution. And so just to say, none of those things have ever been litigated. The question of, is this good law? Is it good policy? Does it help? has never been addressed meaningfully in the court. That doesn't mean that there hasn't been some political edges to the decisions, but fundamentally, those are not things that have been discussed or debated on the record. The decision, this is where I do want to pivot the conversation and how, where Grace will take it up. The decision never really would have changed things for non-US affiliated sex worker-led orgs. And when we're talking about the evidence, when we're talking about rights, we know that the groups that are oftentimes left out of the global health response, so not just the global HIV response in the sense of Pepfar, but also in the rest of the global health response and family planning programs, in maternal health programs, in respectful maternity care. We know that sex worker-led groups are oftentimes the best positioned groups to be able to engage and know their own community needs and know the best practices and be the best responders. And we know that those groups were never going to have a big win because of this case. And so this is still a bad policy. It still is not grounded in health and human rights. It still creates a barrier to sex worker-led organizations, sex worker serving organizations, engaging in the global health response and particularly the HIV response in the way that evidence suggests they should and human rights principles suggest they should. So we, it's a loss in the court. It doesn't extend to the foreign affiliates of US-based organizations, and sex worker rights groups never stood to win a lot in this particular case. I will leave it there for the time being and hand it over to my colleague and be here for questions.
Grace, are you here with us?
Yes, I'm here.
Hello.
Hello.
Grace, I'm going to hand it off to you at this point, as long as your audio is working.
Sorry, I can't hear you.
We just said that you're welcome to get started with your comments on the ruling. I hope you can hear me. It seems like we're having a little audio difficulty or lag time together, but I think we are able to all hear you now. If you want to begin presenting.
Okay, so thank you so much for this opportunity, and I thank you to Benny for the presentation, and I totally agree to what she said, and it is sad, and it is very unfortunate to see that we still have a court ruling which doesn't even consider human rights issues for people, and seeing that the court didn't rule in our favor. I think for us sex workers, it was a sad day that day because we waited for that ruling, and we want to say that it is discouraging to us as the sex worker fraternity, because this means that when it comes to global response on HIV/AIDS issues in relation to sex workers, we are still tied, and it's very hard for us sex workers to be able to respond effectively to issues of HIV. This is because we know Pepfar is the largest is the largest funding for HIV response in Africa, And over time, we have seen sex workers being denied this funding because we are sex worker-led organization. We are sex workers. We stand for sex workers' work, and we stand for sex workers' rights. But when it comes to accessing Pepfar funding, that we know it's the biggest funding in Africa that is funding issues of HIV, it becomes very difficult for sex worker-led groups to access this funding because of the anti-prostitution pledge. And sometimes you'll see that sex workers don't have funding, and sex worker-led groups, their hands are tied, and at the end of the day, sex workers have no option. But at the end of the day, you have to take that money because you want to serve sex workers, because there's limited resources, there's the shrinking civic spaces, and the only funding available is the Pepfar funding. So it leaves sex workers with very few options, and it leaves sex workers to jeopardize the work that we do, so that you can get funding that doesn't resonate to what you do. So I want to say it's really sad, and this one continue even looking at the criminal nature of sex work and such laws, punitive laws like the anti-prostitution pledge, this continue even criminalizing sex work more, because if such a fund doesn't uphold the rights of sex workers, and there is that law that says that you can't access funding if you're advocating for the rights of sex workers. What does that mean? What does that even mean to response of HIV in the continent of Africa? We are talking about getting to zero infection, zero stigma, zero discrimination. Will we ever get there if we have a global law that discriminate and continue to discriminate sex workers because of the rights, because we are sex workers? So I just want to highlight that it's sad, and I think for us sex workers, the struggle continues, and we have a lot of work to do. But we want to thank partners like Change that continues to push and uphold and pushing for these punitive laws to be removed. So we want to thank partners like Change that have really worked hard for this, and partners and donors who continue seeing this as a cause that we should continue advocating for removal of such laws. But for us sex workers, it's sad, and we continue to work, and I want also to highlight that the epidemic will continue, maybe even becoming worse, because if such laws continues to be there, we as sex workers and sex worker organization can't access funding because of what we do. This will continue jeopardizing our work, and it even continues criminalizing what we do. So for me, that's all. And the struggle continues, and we thank partners, and we'll continue working together to see how we can better advocate for this work. So thank you so much, and we will continue working together and seeing how better we can work together and ensure that rights of sex workers continue to be realized in Africa. Thank you.
Thank you so much, Grace, and thank you as well to Biren for your overview of the APLO ruling and of the policy itself. At this point, we'd like to move to the questions portion of the presentation. We've gotten a couple questions already, but if you haven't gotten a chance, please do drop them in the chat, or if for some reason your chat function isn't working, you can email Zoe at zbowles@srhrforall.org. Wonderful. So we're going to start with our first question. This is the question that I'm going to address to Biren, and the question is, what does the ruling mean for organizations that fund sex worker-led organizations, and or if they fund organizations that sub-grant to sex worker-led organizations?
Thanks, Liana. The question depends on what money it is. So if you're a US-based organization and you fund sex worker-led organizations with Pepfar money, it means that you have to keep passing the pledge to those sex worker-led organizations if they're receiving Pepfar funds. If you and the sex worker-led organizations are separate from US money, it continues to not change anything. And if you're a US-based organization and you get Pepfar money, but separately you also fund sex worker-led organizations, you do not need to be binding them, because you in the United States preserve your rights to free speech. And while you do have to pass down the pledge with your Pepfar money, you don't need to be passing it on other things. So there is autonomy to the funding streams if you're a US-based organization. If you are a foreign organization, again, you may, if you take Pepfar money, you are promising as an organization that you have a policy opposing prostitution and sex trafficking. What that looks like for organizations means very different. Most, it just means you're signing that in your contract with the US government. If you're that organization and you take Pepfar money, that's what you're saying about yourself. And if you are subgranting to sex worker-led organizations that Pepfar money, again, the pledge is expected to go with it in your contract. Even if you're a foreign organization and you have taken the pledge by taking Pepfar money, if you are also subgranting to sex worker-led organizations with other donor money, other private money, unlike some other US funding restrictions, you do not have to enforce the pledge on non-US money. I think I know where this question comes from. The US has a lot of funding restrictions, and they have incredible speech and organizing consequences in many different ways. It is important to note that this is different about the pledge. While you as a foreign organization have to sign it and you have to pass it on to anyone receiving Pepfar money from you, it does not extend to other groups receiving other money from you, even if you're a US-based organization.
Thank you for answering that question, Bjorn. And the next question that I see is, how is an affiliate defined in the law? And please give an example. So I know you gave some examples of Save the Children and other organizations that have distinct in-country organizations, but could you elaborate on that a bit?
Well, the Supreme Court couldn't, so it's going to make it a little harder for me too. This one I'm going to get a little salty about the ruling. Justice Kavanaugh wrote the decision, and for the plaintiffs, they've basically spent 7 years trying to work out a definition of affiliate with the US government. And for a number of reasons, both political and practical and lawyerly, the US government has stalled for 7 years on that question of what's an affiliate, who counts as a US-based organization, and what is their affiliates. We don't have a good definition, and that's in many ways all the plaintiffs have been asking for 7 years, is a good definition of affiliate. And Kavanaugh declined to give one in his decision. His decision is, as written, is kind of just misses the point in a pretty big way, and just sort of says this shouldn't be a problem. If you're legally distinct, you're legally distinct, and there's no there shouldn't be any, this shouldn't be hard, basically. And that is a profoundly, I think if you read the dissenting opinion, which is written by Justice Breyer, you see a very different understanding of global health and organizational structures, and a much one that hews more closely to reality as people involved in health and health systems know it to be. So I don't have a good answer for you on what is an affiliate. And the decision as written basically says we don't care. We don't care to define it. Good luck. The only people that matter are US-based organizations. We do have a definition, just a general understanding in US law of what that means. Affiliates, as we were working with and defining them, are generally locally registered entities, but that use the same branding. They may have shared mission statements and values. They may be part of a structure that has some shared leadership or decision makings. So you're talking about organizations that may be very tightly bound, and particularly tightly bound with branding, logos, font choices, to make the entire world understand that they are the same. And the Supreme Court is saying, tough, they're not the same. We don't recognize that in popular understanding, in day-to-day understanding, in clinical understanding, no one may be differentiating between CARE US and CARE Botswana. And I'm using totally random examples. I think Jane from CARE is probably on this and dying that I'm using that as an example. But in popular understanding, we don't differentiate in affiliates necessarily. It is very much about legal structure. And so for the US government to say, or the Supreme Court to say, we're not even going to get into it, it doesn't matter, there's sort of no such thing as affiliates having any close visible relationship with US orgs that might offer them protection, felt like a decision very devoid of all context.
Thank you. And I think we may have lost Grace at some point. So Grace, if you can hear us, unmute yourself. Okay, maybe we'll ask a couple of more questions to you, Byron, and then when Grace comes back. Oh.
No, I can hear you.
Oh, okay, wonderful. Thanks. So Grace, I have a question for you. Is there documented evidence on how the pledge has hurt foreign affiliates?
No, we don't have a documentation.
Is that something that is possible to get in the future?
Yes, it is.
And so a lot of
It is possible.
And so a lot of the questions about, or a lot of the impact that we know of the APLO is mostly what we hear from sex worker-led organizations and organizations that serve sex workers in country, correct? Grace, are you still there?
Yes, I'm here.
Okay. Did you hear my last question?
No, I didn't hear your last question. I'm
okay,
listening.
I was just clarifying. If a lot of the evidence, you talked about the harmful impact of the policy on sex workers and organizations that serve sex workers. And so I just wanted to clarify if that evidence that we have, though it may not be documented or written, is something that we are hearing from sex workers and sex worker-led organizations.
I would say it's evidence that is there because we do the Sex Worker Africa, we do the Sex Worker Academy for Africa, where we have a session on the anti-prostitution pledge and what that means to sex workers. So we have that discussion, and this is what we have collected from what sex workers say. So I'm saying there's no formal documentation, but from our academy, from the academy that we do, this is something that we've collected. But I think this is something that you can explore as the African Sex Workers Alliance to be able to document properly the impact that sex workers have felt due to the anti-prostitution pledge, and also maybe collect evidence on some of the sex worker-led groups that have been denied money due to the anti-prostitution pledge, and some of the sex worker groups that have refused to take Pepfar money due to the anti-prostitution pledge. So that would be a very powerful document if we have it in place. Yeah.
Thank you, Grace.
Liana, just to say that we haven't been measuring the impact on affiliates specifically because the impact of the pledge is so far extending in how we've built the sex worker portion of the HIV response. So I think there's going to be questions coming up about, is there specific changes in impact? And one of the things we've always known about the pledge is that it, like the global gag rule, feeds off fear and miscommunication. So while the pledge doesn't, it should not impact service delivery, it does. And while it shouldn't impact relationships, it does. And so I think part of the job now is harm mitigation to try to make sure affiliates aren't cutting off sub-grantee relationships if they don't have to, and trying to minimize the harm as this applies, knowing now that we have clarity that the prostitution pledge applies to everyone getting Pepfar money except for US-based organizations.
Thank you for that clarification, Bjorn, and for your answer, Grace. The next question is a numbers question. What is the funding in dollars for Pepfar? And I'm going to direct that question to Bjorn, and Grace, if you would like to respond as well.
So it's roughly between 5.5 and $6 billion a year. And that is the sort of easy answer. That I hope it's clear. It's just a huge amount of money. It is the largest single sort of global health response that exists in the world, and that amount of money makes it impossible to just ignore Pepfar as an actor on this, and the law sort of sets tone for so many other people. And so I think there's really important work to be done on thinking about donors that can help bridge the gaps without, sort of, as Grace said, excluding sex workers from the central conversation of the global HIV response, which is, a lot of it is driven by Pepfar money.
Thank you. And I think our last question is, what are the next steps for communications and action that advocates for sex worker rights should be taking now with this SCOTUS decision? And I'll direct that question to both of our panelists. And just to say, we'll be doing on the next slide a brainstorm of some next steps that we can all take. So this is just the start of that conversation. Grace, would you like to start?
Yes. Yeah, let me go first. So I think for the next steps is one, we need to maybe come up with a simple document that sex workers can be able to read on the court ruling. And then number two, we need to start documenting. We need to start documenting the impact that the anti-prostitution pledge has on sex workers, so that in future when we go to court, we have evidence how, like what Ben said about how relationships have changed due to the anti-prostitution pledge, how service delivery has been affected because of the anti-prostitution pledge. I think that is one of the next steps, documenting, so that when we go to court again, we have evidence on how the anti-prostitution pledge has affected sex workers and service delivery. Yes. And also the last thing, we need to continue doing advocacy as sex workers with the American organization that we know get funding from Pepfar to see can they be allies, who can be our allies at this point, and how can we push for the change of this, and just creating partnership and allies to see how we can better coordinate our advocacy. Yeah.
Thank you, Grace. Bjorn, would you like to add anything?
I think everything Grace says is sort of the most important immediate stuff. For people who are based in the US, I think we have to understand that fundamentally, this portion of the Pepfar law undermines Pepfar's goals, it undermines the evidence, and it undermines human rights. And so getting rid of the Pepfar pledge needs to be the focus of US-based actors. And there's a lot of policy things going on in the US, but we have to get rid of the pledge. It's been hampering the response for 16 years. And one way that can be done, there is a piece of legislation called the GLOBE Act, which is a Global LGBT Rights Act introduced by Representative Titus in the House. And the GLOBE Act really very much encompasses huge amounts of foreign policy around global LGBT rights. But the pledge is one of the pieces that enormously impacts LGBT populations worldwide. Sex worker-led organizations are often the sort of safest, most trusted clinical providers or prevention actors for LGBT populations. And so the GLOBE Act does include striking the APLO. And so for US-based actors, there's a lot of reasons to support the GLOBE Act, but getting rid of the APLO is certainly one of them.
Thank you both. And I know I said that was our last question, but there are a bunch of questions that came in at the last minute, and I think we should cover these. So Grace, can you talk about the conflation of prostitution and trafficking and sex work in the definition of the APLO? And Biren, if you also could talk about how does the US government misunderstand and misuse these terms?
So let me talk about the conflation of sex work and sex trafficking. For sex work is between consenting adults, and sex work is for adults. But most of the times you'll find people saying that you can't willingly be a sex worker. So all the time when you meet people and when you meet anti-sex workers activists, they'll tell you can't be a sex worker, but you've been trafficked into sex work. So there's a lot of conflation between sex work and trafficking, and this is because we as sex workers, we say sex work is work, but there are people who don't believe that someone can be a sex worker, and at last, what happens is we as sex workers who know we are sex workers, people at the end of the day will say they are not sex workers, but you can't sell sex, but you've been forced into sex work, and people will say you've been trafficked. So that is the confliction that people always see, and we have seen even some people, even in global meetings, standing up and saying you can't be a sex worker, but you've been, for example, because you come from Africa, you've been forced to do sex work because you're poor or because there's something you're looking for. But for us, we say sex work is work, and we are doing sex work willingly. So that's the fact that people don't believe that is sex work, and that is the confliction that you've seen even in the sex work movement, where people will say that you've been trafficked into sex work, but you're not a sex worker. So that confliction, but we as sex workers' rights, as sex workers activists, and as sex workers, we are out there and very vocal saying that sex work is work, and we are sex workers. So that is what basically we experience. Yeah.
Leanna, I think the question for me is sort of what role does the US government play in this conflation? The US government at a federal level officially conflates sex work and trafficking for the purposes of sex. And that originates in the Bush administration with a national security presidential directive that is there sort of like a secret version of presidential memorandums or executive orders. And it sort of states that there is no such thing as sex work and that all sex work is trafficking. And that, of course, is from 2002, 2003. It then Representative Chris Smith from New Jersey puts it in at the last minute into the Pepfar bill. There's never been any evidence, sort of any open discussion of it in US federal politics. It was contested at the time. Representative Barbara Lee from Oakland has been dead set against it, and understanding fundamentally the harm of creating more stigma in a bill that is meant to sort of address it as we think about how we craft health programs that invite people in rather than exclude them. It is the official US policy at this point. There's a number of places we need to take it out, including the Trafficking Victims Protection Act, the NSPD 22, and Pepfar. And I think it is something that's been very under discussed how our official US policy does not align with health best practice, evidence, or human rights principles. And there's been a big gap between the legislating on it and sort of all of the rest of the evidence and human rights principles.
Thank you. And Grace, I wonder if I can ask you how donors can support sex workers during this time of the COVID pandemic?
Okay, so during this time of the pandemic, there have been a lot of sex worker human rights violation, and we've seen an increase of violation of violence among sex workers. So I think one of the support that we as sex workers would like is the protection of sex workers from the violence that sex workers are facing. We also need support on documentation of the violation, because people report, but documentation is not done adequately. I think documentation should be done, even if it's through both written and audio and videos, if it's possible, so that we can have evidence. And then a lot of sex workers have lost income. We know most of the countries, it's either lockdown, a partial lockdown or total lockdown, and even in some countries there's no opening of bars or restaurants, and those are the places where we as sex workers get money. Most of the sex workers have lost income, and so their immediate needs, like where sex workers, for example, sex workers who operate in the brothel, don't have shelter. Their immediate needs like shelter, food, and then I think those are some of the things that sex workers would like at this time. But also in the long term, we would like donors to support sex workers to start even thinking along lines of economic options in terms of what other economic options do sex workers can engage in terms of such epidemics, so that sex workers don't bear the blunt the way we are seeing that sex workers have now really suffered, because we only depend on sex workers. But are there other economic options that sex workers can have discussion with partners and donors to see how better sex workers can even maybe have financial skills or have income generating activities that can be able to support sex workers in times of pandemics, or in times of other maybe crises that will come up. Yeah, so that's it. But I'm not alone. There are other sex workers on this line who can also contribute if I left anything.
Thank you, Grace. And two more questions before we move on to the next section of the presentation. This will address to Bjorn. The question is, so the is really like the Mexico City policy, but without the Pompeo expansion. That is, it applies to non-US grantees or sub-grantees of global health assistance from the US government, but not to any other grants from other donors that the grantees may be receiving.
That is a question made for me in my language. Yes, that's exactly right. This decision sort of makes the pledge analogous to the GGR, the global gag rule before the Pompeo expansion, but with the caveat that, again, this only applies to Pepfar money and not to this sort of the whole expanse of global health assistance. I will sort of warn that the US is not always careful about their contract provisions and what they put in which contracts. So this is something that people should read very carefully and make sure that this is actually Pepfar money you're receiving if you're being asked to sign the pledge. We have seen plenty of cases in which someone receiving a different type of US development assistance or global health assistance is being asked to sign the pledge or sees it in their contract. That's always a good thing to check in with. If you're a big organization, check in with your counsel. If you're not, always feel free to check in with me to see if it is the right things to be asking you to sign.
Thank you. And our last question is, how does the court decide to ignore the laws of other countries about sex work? And how do they ignore the context in which it occurs in terms of gender inequality? There are many other issues that the US government could focus on without punishing women, rather than the systems that support injustice. Half comment, half question.
Definitely, as a comment, it's completely correct. You know, the legal answer is the US court system is very limited in many ways. Supreme Court decisions tend to be very narrow. Unlike a country like South Africa, in the US, the enumerated rights are very small. Our constitutional law is in many ways very, very narrow. And so things like this violates the sovereignty of other countries or this flies in the face of evidence, those are not things that are easy and in most cases even possible to engage with in the US courts. We need to engage with them at the political level and change the laws and hold our legislators to a different set of expectations for how they should be doing global health funding.
Thank you. And one last quick question in the next 2 minutes. What is the monitoring mechanism to ensure enforcement and what does it cost?
There is an expectation from the US government that you will self-monitor. I want to be careful in this answer because I don't want to be cavalier. It's a contract, it's a funding stipulation, and organizations do need to figure out internally exactly what compliance with the pledge looks like for them. But the Pepfar law is very clear that there is not intended to be any service delivery restrictions on this. Sex workers should be able to get affirming, safe, targeted, focused prevention and treatment services, and that's clear in the law. So I think organizations need to do a very careful reading. I don't think it's wrong to read the restrictions of the pledge narrowly and not over-interpret it for yourselves. The monitoring mechanism from the US government has always been an expectation that groups will do it themselves. It is not like the global gag rule in which there are very stiff penalties written into the contract. It does not have that, and people should not conflate those sort of very, very serious compliance mechanisms in the global gag rule or protecting life and global health assistance with the pledge. The pledge is has more of an expectation that groups should be doing it themselves.
Great, thank you, Bjorn, and thank you, Grace, and thank you everyone for your wonderful questions. I apologize we didn't get to all of them, but this webinar will be recorded, and we will also provide Bjorn and Grace's email address when we follow up with the recording. And so moving on to our last portion, we wanted to open it up for a brainstorm about what next steps and actions that you plan to take to raise awareness around the APLO, and oppose it. So I've provided a couple of examples here. If you're based in the US, one thing you could do is support the GLOBE Act, which Bjorn mentioned earlier. You can also check out the APLO fact sheet that Change has compiled that's on our website, or you can talk to people in your community about the APLO and how it harms Pepfar programs and sex workers. So at this time, if you could, please drop in the chat what you are hoping to take from this webinar in terms of next steps and actions, or you can email them to Zoe at cbulls@srhrforall.org.
On my end, I do have to say that I'm very struck by the documentation conversation that Grace led us through, and I think thinking through some sort of simple, accessible mechanism to connect sex worker rights advocates and activists and sex workers around the world, where we can document the harm of this and just have a sort of like compendium of everybody's experience, is a great idea, and it's definitely very doable. And I look forward to working with OSWA and potentially other folks on this call about thinking through how we can document the harms of this US policy.
Thank you, Zoe. And some comments are coming in. Just give me 1 second. All right, one participant says they're going to talk to everyone in their community about this policy and what they learned today, which is great. Love that. Another says, I will continue to discuss this with the Sex Work Donor Collaborative and continue to fund sex worker-led organizations directly as a feminist fund. Love that. Wonderful. Any last action items that we want to share?
Also, I received a great email from a colleague at OSWA noting that it would be super helpful to provide the information provided in this webinar in different languages. So look forward to thinking through how communications on our part that are trying to demystify restrictive and punitive US foreign policies can be accessible to folks all around the world and in their own languages so that we can all be on the same page and working together. So thank you to Rose for that.
Thank you, Zoe, and thank you, Rose. And our last comment is, I'm going to consult more with sex workers on how the APLO is affecting sex workers and come up with a comprehensive document. And that's from Grace. So love to hear that and would love to work with you, Grace, through Change to make sure that that happens. And the last comment, oh, they're coming in quickly here. I'm going to talk to sex workers and community to understand how harmful these policies are to the sex work sector. I'm going to link across organizations, networks, and issues, and have other key populations join forces to oppose the APLO. Wonderful. Well, on that note, let me just click the next slide here. Thank you very much, everyone, for joining today's webinar. I hope it was informative and that you were able to learn something new and walk away with some next steps and actions in how we're going to oppose the APLO and the harm that it causes and the fact that it undermines Pepfar's programs. If you have any questions, you can feel free to reach out to any of the panelists on this webinar. As I said, we'll be sending out a recording, which will include the email addresses for Bjorn and for Grace. And also we can include mine and Zoe's as well, if that's helpful. So thank you very much, everyone. Thank you very much to Grace and Bjorn, our panelists. We hope you have a wonderful rest of your day.
Thank you so much, everyone, for joining. Really looking forward to collaborating with you moving forward.
Okay, bye.
Thank you. Bye.
Bye.
Thank you, Grace.
Thank